Hospitals like the ones here on University throughout Toronto and of course throughout the entire province, they're at a breaking point. ICUs are full and it's essential workers who have yet to receive their vaccines that are being brought here. And that is why there's a push to make sure they are a priority to get their vaccines.
The vaccines are going out, great, but they're not going to the people that are driving transmission, that are being forced to work, that are being forced to transmit this disease.
While essential workers may not fall into the age categories set out for early vaccinations, those adding up the numbers say they should now be first in line. COVID cases and deaths are spiking in neighborhoods with the highest proportion of those working in essential services. ICU units are full, while getting a shot in the arm remains difficult for some.
They shouldn't just buy us time to get hospitals emptied so we can do the same thing over again. They should buy us time to get the right people protected that are really driving transmission.
Toronto did put a community vaccine plan in place, including working with local agencies and helping those most vulnerable get to clinics. Mobile clinics to date have made their way to long-term care homes and some community housing buildings, only to provide vaccines to those who fall within the existing framework.
Is there a way perhaps to do more to get those shots to those specific places, perhaps where they work, so we know that the essential workers are getting those vaccines first?
So the starting point is where the clinics are and where they go. Certainly we have our mass immunization clinics, our hospital partners are running clinics, but we also have mobile clinics across the city that are being operated throughout the healthcare system, focused on those higher risk communities.
Ontario is expanding the number of pharmacies that will be administering vaccines by 380, including more than 50 additional locations in Toronto alone. Some of those will be more accessible in neighborhoods hardest hit by COVID cases. But the push for sick days has now become the need for paid time off, something unions are calling on the province to do so those same essential workers can go and get their shot. Unifor's Jerry Diaz said, quote, employers who are advocating for lifting restrictions must also do their part and remove all barriers to workers getting the vaccine.
Rather than necessarily worrying about every 50-year-old, we should be worrying about every 20-year-old in an essential workplace first.
That means making the call and setting up shop for vaccination beyond just the communities where they live. In that conversation with Toronto Board of Health Chair Joe Cressy, I also asked him how easy it is to pivot and getting those mobile clinics to workplaces or other easy areas for those essential workers to access. He said the call is on the province. However, Health Minister Christine Elliott was also asked today, and she said it's up to the individual public health units to determine how everything is distributed.